toddler supposed to grow? Is it normal that my toddler doesn't really seem that interested in eating? My name is Dr. E. I'm a board certified pediatrician and I'm also a new mom. Today we're going to talk about toddlerhood. If this is your first time on my channel, thank you so much for being here. Make sure to subscribe to the channel. You can also find me on Instagram and TikTok. My username is the primary pediatrician on all platforms. A lot of the times toddler is a general term that's kind of thrown out. I'm going to specify that when I'm saying toddler, I'm talking about a child who's like 1.5, so 15 months, 18 months to that 2.5 years. So kind of in that range is what I mean by a toddler. So toddlerhood and this age range is one of my favorites. They're unpredictable, they're loving, they're energetic, they're also hysterical. So I think that toddlerhood is really a unique time in a child's life. Toddlers never cease to amaze me. So let's start by talking about the energy that toddlers have. This is usually the very first thing that comes to mind when anybody thinks about a toddler. Energy in toddlers tends to peak between 2 to 3 years old. And if you have a toddler, you'd probably agree with that statement. There's also a decrease in growth at this time. So a lot of times toddlers won't really have much of an appetite. This can sometimes be exacerbated by the fact that toddlers really like to graze. So what I mean by grazing is they like to have pouches and puffs and snack throughout the day, and they don't really sit for full meals. Something to help with this can be a more predictable eating schedule. So scheduling a sit-down time to eat 3 times a day for breakfast, lunch, and dinner, and then small snacks in between, one snack in between each of those meals as well. That way your child knows exactly when they're going to be eating and they're not filling up on just random food throughout the day. Typically in this age range, we expect a child to gain between 4 to 5 pounds per year. Now, of course, some kids can gain more than this, some can gain less, but on average, that's what we would expect. Now, usually babies start taking their very first steps somewhere between 12 to 15 months and are usually walking pretty consistently by 15 to 18 months. What you'll notice is in toddlerhood, typically children are bow-legged. So what that means is instead of their legs being straight up and down, they're curved and they kind of bow out. So this is very common, especially in younger kids. So between 15 months to 24 months, knees are typically bowed. This very shortly transitions into knock-kneed, or where the legs kind of go in at the knee. This is really common in toddlerhood and kind of in older kids, usually beyond 24 months. Kids begin to get knock-kneed. This is also normal development. So I always like to counsel parents on kind of that transition of being bow-legged to knock-kneed that you'll see in toddlerhood. These terms also have medical terms, so they're called genuvalgum, which is knock-kneed, or genuvarus, which is bow-legged. A lot of times I'll have family ask, when is my child gonna walk in their normal way that they'll walk for the rest of their life? Usually a mature gait is developed around 3 years old. This can vary from kid to kid, and a persistent abnormal gait or a persistent abnormal way that your child is walking is definitely something to let your pediatrician know about, especially if it's all the time and it's not getting any better. Your pediatrician will be able to let you know if this is a normal pattern of development or something that needs to be looked at further. So as kids have more energy, they're walking more, it also makes sense that kids are also needing a lot of rest. So typically a toddler will need anywhere between 11 to 12 hours of sleep per day. This is in the form of one nap throughout the day and then, a 10 or 11 hour span of sleep at night. Now, this isn't always the case, and a lot of times toddlers can still wake up throughout the night. So if your toddler is not sleeping through the night, you are not alone, and it's not necessarily abnormal. Sometimes kids just tend to wake up more throughout the night. If you're worried about the way your child's sleeping or your child's really waking up a lot during the night, talk with your pediatrician about different remedies to help them sleep longer. So shifting from talking about toddler sleep, let's talk about toddler development. So typically, I always get questions in clinic too about toddlers who are using a specific hand or always using their left hand or their right hand. When are they going to be labeled as right-handed or left-handed? Usually this happens somewhere in the 3rd year of life. This doesn't develop in infancy, and I think that's really something important to note, that if you do notice handedness in your child before that 3rd year of life, a lot of times that can be a cause of concern. It should definitely be something that's brought up to your doctor. Typically, the 3rd year of life is when you'll start to see them develop a preference for their hand, definitely in that preschool range. Now it's time to talk about one of my favorite parts of toddlers, their language development. So toddlers say the funniest things and they never cease to make me crack up in clinic. A lot of times they don't have any filters and they're hysterical. So I'm going to talk about what normal language is for a toddler. Biggest increase in language somewhere between age 2 to 5 years old. This language jump will go from about 50 words to over 2,000 words. That's a huge jump. So it makes sense that they have so much going on in their head that a lot of times it just comes out. Something that is tricky for toddlers is their emotional development tends to go a little bit faster than their verbal skills. A lot of times they're just learning to use all of these words. And so sometimes their brains are going faster than they actually are speaking. So this can lead to sometimes stuttering. This can lead to kids getting really frustrated and these tantrums because they're not able to express exactly how they're feeling. I can do a full video on really both of those topics, stuttering. I can talk about tantrums in toddlers. If you want to see videos like that, comment down below what you're interested in and I'll be sure to make them. I'm not going to talk about it too much in this video, but just kind of going over the fact that toddlers' brains tend to run really, really fast, but their verbal skills are just barely getting developed. So a lot of times they can't express what they're feeling. Something that you can do to help increase vocabulary is reading out loud a picture book. Reading aloud to toddlers is best done in an interactive form. So the parent can repeatedly ask for the child's attention by asking a question or pointing to a picture and kind of refocusing the toddler on that picture and asking a question like, what color is the sun? What color is the apple? What's sitting next to the pig? Things like that to keep the toddler engaged. If you think a toddler is just going to sit on your lap and allow you to read a picture book to them, it's probably not the case. The last thing that makes toddlers so fascinating is the fact that their brains think in a magical thinking. So we're taught in child development courses and in pediatrics that at this age, children's brains are magical thinking. That's kind of the thinking process that they go through. What this means is if a child sees somebody with an umbrella and then it starts raining, they might associate that that person made it start raining by carrying the umbrella. So this magical thinking and knowing how a toddler thinks can make it really helpful as parents and as pediatricians to help communicate with the toddler and kind of figure out their thought process. I think it's really important to know that kids don't think the same way that we do, and so making sure that we're understanding their level of thinking is really important. All right, so that's my general breakdown of toddlerhood. If you have additional questions, if you have funny things that your toddler said or anything like that, please leave them in the comments below. I would love to read them. To subscribe to the channel, like this video, and I'll see you in next week's video.